I was eating right, I was living right, doing what I needed to do, but I just didn't have any energy. So I started looking into the options, took a sleep study, and realized that I did have sleep apnea. And really did the research on it, trying to figure out the best way for me to handle it and for me to treat it. And it really, really hit home with me when my wife said, I can't sleep at night. You're waking me up all night long. She's kicking me all night long.
We had children. I never slept great. I became a very light sleeper. And so it was extremely difficult to, as a spouse, to share the same bed. And I felt like we were so young, I didn't really want to go into the guest room. So I just stuck through it. And it was a race at night to try to go to sleep before he went to sleep. It was nudging him in the middle of the night. It was kicking him as he snored, and sometimes wondering if he was actually going to breathe again. I knew, as a nurse, I knew he definitely was not getting good quality sleep. He had dark circles under his eyes. He was constantly tired and fatigued, even after a long work week.
About that same time, the dental world started kind of morphing and really became a buzzword as far as sleep dentistry. And we started offering mandibular advancement appliances, which is a fancy word for basically a little oral appliance you can slip in that will treat sleep apnea. So I figured I had nothing to lose. I'm a dentist, I can make one for myself, I'll try it out, and I became the guinea pig for our practice.
So he decided he would be the guinea pig, and he did the CT scan and brought home a picture of it and showed me, look at my airway, it's completely red. And I said, well, you definitively have to get this appliance, you've got to try it.
And so that is all it is. It basically fits on the top, fits on the bottom, keeps your jaw forward, opens your airway.
And the first night he had it in, it was utter silence. I was actually startled and thought to myself, is he breathing? And I reached over and actually put my hand over his mouth to make sure that he was breathing. And a huge sense of relief came over me because I could actually sleep. Sleep is vital for everyone, and so not to be emotional about it, but okay.
I can tell you from night one, my wife slept through the night, and I think was pretty amazed that I was silent all night long. The biggest immediate changes, which were pretty unbelievable, were I was dreaming like crazy. I'd never, you just never get deep enough in sleep. After a few weeks, the energy levels were completely different. I wasn't sleeping, taking naps in the middle of the day. You wake up, you're ready to go. It literally is like a pacifier. I have to put it in at night to go to sleep. If I don't put it in and I wake up the next day and I haven't worn it, I'm wrecked.
It became pleasant to go to sleep at night. There was just no noise. It was incredible. I went to my work. I work in an operating room. I work with, for 20 years, and I've worked with ENT surgeons that perform invasive surgeries to correct sleep apnea issues. And I thought, if this device can prevent someone from having to go through general anesthesia and surgery, it's a game changer.
I don't care how you treat it, whether it's with our appliance or a CPAP or any of the effective means of treating it. It's a game changer, it's a life changer, and not only for me, but for the fact that my wife is sleeping through the night. She is in a much better frame of mind, and it's changed my life.